Well, welcome back, everyone, for day 2 of our council meeting, our June council meeting. So we're going to start off with a presentation from Pat Maston is kind of filling in as the acting director of DERT. Will give the DERT presentation in subsequent meetings. David, you're going to be on the hook. So Pat, thanks for your agreeing to do this. So I'll turn the virtual podium over to you.
All right. Thanks. Let's see. Thank you, Rick, and welcome back. I hope everyone had a good evening. As we do pretty much every council meeting, I'm going to be presenting an overview of the activities from the Division of Extramural Research and Training. As Rick said, I'm Pat Maston. I'm the full-time deputy director and recently the acting director. And let's see if I have control. There we go. So here are a few of the things we're going to talk about today. As we typically do, I'm going to give some staffing updates for DERT. I'm going to talk about a few DER activities. And as Rick mentioned yesterday, and as you may have gathered from the agenda, kind of the theme for this week is environmental justice, environmental health disparities. You'll be hearing a couple of good talks shortly after my presentation is over. But I wanted to spend a few minutes talking about some DERT, environmental justice and environmental health disparities programs that are going on in DERT. After that, I will turn it over to Dr. Melissa Smar to talk about some diversity, equity, and inclusion updates that are happening across NAEHS, but more especially in DERT. And then finally, I'll wrap up with a very brief discussion or update on climate change activities. So staffing updates, this is always a good and a bad thing. So we're very pleased to welcome Mbeja Lumite, I hope I did that right, who just recently joined the program analysis branch. This is Christy Drew's branch. He comes to us from HRSA, the Health Resources and Services Administration, but he was also at the Centers for Disease Control and Prevention in the Office of the Assistant Secretary of Health before. He comes to us with a wealth of experience in program development and program management, as well as research evaluation and data analysis, which is great because that's pretty much what PAB does. One of his bigger tasks, starting right off, is that he'll be responsible for assigning all incoming applications to NAEHS to the right program officer and to the right topic area. This is an important and a challenging task, one that Steve Toshimi was doing before, so I'm sure Mbeja will do well in this one. And he'll be involved in a variety of other evaluation activities as well. So from the good to the bad, we say goodbye to Laura Thomas here. Laura was with us for 5.5 years in the office, in the scientific review office, in the scientific review branch as a scientific review officer. And in addition to doing a number of high-level reviews, she also participated in a number of other activities. She was on the DERT Science Planning Committee for 4 years and was chair for 1. And she was also a member of 3 different NAEHS faculties. Rick referred to these a little bit yesterday. These are cross-divisional activities within NAEHS that focus on particularly high priority areas for us. The 3 that Laura belonged to were neuroscience, microbiome, and health disparities. In addition, she was involved in a number of other NIH and DRT diversity, equity, and inclusion activities. Most interesting to me is she was a founding member of the NIH Sound Health Initiative Working Group. This was a group that was looking at the benefits of playing music or listening music to your health. And she jumped right in when she got here to that. I'm blanking out on what her instrument is that she plays, but if somebody knows that and wants to put it in the chat, that might be useful. She's moved on to the National Institute of Mental Health, where she's going to be a program officer in the developmental mechanisms. Oh, thank you, Alfonso. She played the flute. Thank you. Where she's going to be a program officer in the developmental mechanisms and trajectories psychotherapy branch. So we're going to miss Laura, and we're glad we had her when we did, but we wish her well. And of course, Rick mentioned a big personnel change. David Balshaw has agreed gratefully to take on the role of acting director of the division until we have a permanent director. Rick mentioned some of his kudos. I've worked with David for a long time now. I don't know if anyone in the division who knows the portfolio any better than he does. He has a strong history with the division, and I think he'll do a great job, and I really look forward to working with him as we go forward. So I just want to go over a few activities that have happened in DERT recently. The first one here is a little bit unusual, but it's something I'm fairly excited about. So DERT puts a high priority to customer service. We like to give as much help to the extramural research community as we can. And when people come to us asking about getting funded, we always tell them, check with your program officer, they're your friend, and use them to help you navigate the rough waters here. And we're often asked to visit universities to provide grant writing seminars, or to help students, or just generally to help people understand how the grant system works. But of course, we have limited time and resources, even though we would like to do more. And then COVID hit, and there's not much good you can say about COVID, but one thing you can say is we learned how to do things virtually better. And so now we have the opportunity to do this on a more expansive basis. What kind of services might people be interested in? You can see, this is the web page I have marked here. Here's the front page, and you can see we can help people in writing grants, understanding the peer review. If you're just starting, some of our evaluators can help you with logic models and so on. So we decided to try to make this a little more available. So if you go to this website, you'll find a request form. And if you're interested in some of these services, you just fill out the form and it'll go to our group, and we can decide how to handle it. Even though it's being conducted primarily out of the program analysis branch, a lot of people in the division are involved, and wouldn't be surprised if I get to do one of these one day too. But it's still in the pilot phase, and we're working out some of the details. But for instance, if we get 10 requests for webinars on how to write grants, we may put on a virtual symposium where people can just call in and we don't have to worry about the travel or whatever. But again, we're in pilot phase, so be patient with us as we work out how to get services to you. That's something I think is really unique. Next, I want to talk about some of the meetings that have happened that DR staff either conducted or been involved in since our last council meeting. I want to start by talking about the Advancing Environmental Health Equity Through Implementation Science Workshop. This is actually we sponsored it, but was co-sponsored by a number of other institutes within NIH. And our main lead on it was Lindsay Martin. The topics that they talked about were basically what is implementation science and how does it interface with environmental health science, and to improve or to help both of these sciences. They looked at evidence-based prevention and intervention strategies, and talked about emerging environmental health issues, as well as community and multi-sectoral partnerships and how to develop those. So if you're interested, you should check with, contact us or check with Lindsay Martin about perhaps, if this meeting was recorded. I just don't know. The other meeting I want to talk about next is the Modernizing Neurotoxicology at NIHS. This meeting was put on by the Neuroscience Cross Institute faculty. So it was truly a collaborative effort and involved all three science divisions. And the goal was to examine the applicability, challenges, and opportunities for incorporating modern day neuroscience approaches to toxicological research. This meeting was recorded, and hopefully that recording will be available to the public pretty soon. I'm told this by John Hollander, who is, I think, our main point of contact on this. And then finally, I want to mention the worker training awardee meeting down here. These meetings occur twice a year. This one focused on two important topics that are important to us right now, including climate change and environmental justice. And as I'll talk a little bit more in a minute, the worker training program has been out in front on these topics for a number of years. And so I will kind of give you a little more of an update then. Like I say, if you check with us, and some of these meetings were recorded and the recordings are available, we'll let you know how to get to those. So then next step is to talk about the meetings that we're planning between now and our next council meeting in September. The first one I'll mention is this diet, nutrition, and autism meeting. The real name for this will be, can nutrition modify the impact of environmental exposures on autism spectrum disorder? Didn't have enough room on the slide there. This will be happening in a couple of weeks, June 21, 22. And the goal is to look at how nutritional interventions might reduce the risk of autism spectrum disorders that are caused by non-genetic factors. So for instance, if there, can we identify nutritional interventions that a woman can take to reduce the risk of autism spectrum disorders that might occur as a result of being exposed to, for instance, air pollution. So that meeting, like I say, is in a couple of weeks. Next, I will mention the NYC Exposon Symposium. David Baushaw is on the organizing committee for this, and Rick will be giving the keynote speech. The symposium has a strong emphasis on social implications of exposome and application to health disparities and environmental justice. So it plays very nicely into the theme of our meeting this week. And I will just mention briefly here, because you'll hear more about it, is we'll have a town hall, which will be the kind of the continuation of a program that we've been putting together relating to listening sessions for HBCUs and minority serving institutions. I believe Melissa will give you more details about that. And so, as I mentioned, the general theme today is environmental justice and environmental health disparities. And I kind of want to talk to you about some of the activities that have gone on and are currently going on in DERT. About 2 years ago, our September 2020 council meeting, when we had a theme of diversity, inclusion, and equity, I presented this slide, and it shows some of the environmental justice and environmental health disparities activities that have gone on in DERT, going back to 1994 and then up to the present. This upper block, the pink items here, show some of the programs that are non-center programs. Most of these you see happened back in the late 1990s, early 2000s, in the community-based research, health disparities, and environmental justice partners and communication. Over time, the programs and the way we do things has evolved. So this blank space here is a little bit deceiving because a lot of what is going on is taking place through the investigator-initiated program. So the point of a good RFA is to seed the field so that you get more investigator-initiated grants, which we have been successful in doing. So that's why you don't see new programs. We did have the new research to action program, which has recently ended and will be starting up again at some point. During this whole time, as I mentioned, the worker training program and education program has been very active in the area of environmental justice. And then just briefly mentioning all of our centers programs down here, our core centers program, our Superfund program, and children's centers, these all have a community or an outreach component. So we continue this, this emphasis through these programs as well. Again, mentioning the cross-divisional faculties. One of these faculties is the Environmental Health Disparities and Environmental Justice faculty. I show you a list of the DERT people who are on this faculty. It's about a fourth of our division, actually. If you're interested in the activities that they're into, you can go to this website down here. I'll mention a couple of workshops that they have put on. The first one here is entitled Addressing Racism as a Public Health Issue Through the Lens of Environmental Health Disparities and Environmental Justice. The workshop was designed to foster dialogue among NIH employees, outside researchers, and members of the community. The idea was to look at the issue of systemic racism, but as a public health problem. It was designed to inform the community of the current EHD research and outreach activities, but also to engage the community and local leaders in these activities. The other workshop or conference that the faculty group put together is the environmental impacts on women's health disparities and reproductive health. This just happened about a month ago. It was well attended and well received. We had several members from DRT who are key in this process, putting this together and moderating. Melissa Smar, Rosemary Moody, Sarah Emma Legby, and A.B. Bowles, at least. And so the other meeting I want to mention that's related to EJ and EHD is this in the Advancing Environmental Health Equity that I mentioned earlier. So this is just to show we are still being active in this area. Continuing on this theme, there are several members of DERT who are members of the Department of Health and Human Services Interagency and EJ Working Group. Sharon, Liam, Christy, Melissa, and Lindsay. And one of the activities that the group has been involved is putting out a request for information. You can see the title here. And the purpose of this is to look for input from the public for developing the department's draft outline for the further development of a EJ strategy and implementation plan. I've been told that the RFI is still open, so if you're interested in weighing in, you can go to this website and provide your opinion. Again, as I mentioned, the worker training program has been very active in this area. And I want to highlight one program here, the Environmental Career Worker Training Program, Ecwtp. The point of this program, as with all the worker training programs, is to develop a workforce for cleaning up environmental and hazards and for engaging in recovery efforts after, for instance, like hurricanes or toxic spills and that kind of thing. This is a little bit different because it focuses on communities in which environmental justice issues are a little more prominent. The program has been very successful. A review was done, evaluation, that showed that like 70% of the people engaged in the program find employment afterwards, and the return on the investment has just been remarkable. This program has also been chosen by the White House to be a pilot program in the Justice 40 initiative. And I think you'll be hearing more about this later as well. The Justice 40 program is a whole of government effort to ensure that federal agencies work with states and local communities to make good on President Biden's promise to deliver at least 40% of the overall benefits from federal investments in climate change and clean energy to disadvantaged communities. So we're very proud to be part of that program. If you all are aware of our Environmental Health Science Core Centers program, I want to just mention one part of that, which is the community engagement. Every program is required to have this. We had this recently, a couple of forums on precision environmental health and anti-racism, which took place in May, so we're still active in that area. Institute-wide, NIH invited two very good speakers to talk about these kinds of issues. The first was Monica Ramirez and Ota, who talked about participatory research and data sharing. She's from the University of Arizona. And then Dr. Tom Leviste presented our Ken Oldman Distinguished Lecture Award presentation in February on the social environment and inequalities in health. Both were great presentations. And you're going to be hearing from Liam O'Fallon in a few minutes about our Partners in Environmental Public Health program. He'll talk about a number of things, but in recent times, we've had a podcast on environmental justice and a couple of webinars related to community research. So with that, I am going to pause for a minute and just let you know that following our September council meeting in 2020 that I mentioned a few minutes ago, a number of staff from DERT kind of self-assembled into a diversity, equity, and inclusion working group. And so I'm going to turn the podium over now to Dr. Melissa Smar from the Population Health Branch in DRT to give you an overview of that group a little bit and talk about one program that I'm particularly think you'll find interesting. They were dealing with listening sessions with historically Black colleges and universities and other minority serving institutions. So Melissa, if you can take it from here. Will I be controlling your slides, Melissa? John, is that how we're going to do it?
If you can control the slides, that would be helpful.
Okay, take it away. Thank you.
Thank you. Good morning, everyone. And before I begin, I just want to acknowledge Dr. Christy Pettibone from the Program Analysis Branch. Together, we both served as coordinators for the listening sessions with historically Black colleges and universities and other minority serving institutions, as well as some of the various diversity, equity, and inclusion initiatives that will be covered in this presentation. Next slide, please. The Division of Extramural Research and Training has been working toward identifying how we can support a more diverse, equitable, and inclusive environmental health sciences community within our sphere of influence. These goals have included promoting an internal culture of diversity, equity, and inclusion, formalizing the coordination of DEI efforts with the formalization or standing up of a working group, which started in February of 2021 under the leadership of our former acting division director, Dr. Gary Ellison, as well as identifying ways to build authentic partnerships with minority serving institutions, not just in our own backyard, but nationally, being more intentional in terms of our engagement with current and potential grantees, developing funding opportunities to support diversity in research and the scientific workforce, and making a commitment to evaluate our progress and areas for opportunity in regards to diversity, equity, and inclusion. Next slide, please. Want to advance? Okay. So this slide is in no way a comprehensive representation of the activities that our DERT colleagues have implemented, and they have been hard at work and intentional in trying to implement and plan activities that support the goals that were presented on the previous slide. But merely this is a snapshot of just select activities that were implemented to support these division goals. And will, in addition to the listening sessions that I will discuss in the subsequent slides. So if we think about our efforts to be more intentional with our grantees and our engagement with both current and potential grantees, on July 19th of 2021, the NAEHS hosted its first Diverse Researchers Integrated Virtual Engagement Network, or as we like to affectionately call it, the DRIVEN meeting. This meeting was designed to provide networking opportunities between former and current diversity supplement recipients of NAEHS. We provided a forum for diversity supplement recipients to have discussions around environmental health science career pathways that are both academic and non-academic. We provided a forum to create an opportunity for DERT staff to learn where some of the traditional roadblocks may be for environmental health scientists from underrepresented groups in the scientific community. Additionally, in July of 2021, the NAEHS also hosted a joint ISES-ISEE pre-conference workshop that focused on demystifying the grant application process. During this pre-conference workshop, we provided tips for applicants on grant writing and highlighted funding programs relevant to the ISES-ISEE communities. The workshop participants also got to dig a little deeper to discuss strategies to increase the recruitment and retention of PIs and students from groups who have been historically underrepresented in biomedical research and historically underfunded by NIH. To improve partnerships with students and faculty at minority serving institutions, members of the DERT hosted a session on environmental health in Indigenous and Latino communities, focusing on environmental justice and climate change at the Society for Advancement of Chicanos and Hispanics and Native Americans in Science, also known as SACNIS, and this took place in October of 2021. And while the Office of Science of Education and Diversity had a historic relationship of participating in SACNIS, this was a first for DERT, but it wasn't the last opportunity. Followed by an environmental health funding opportunity session that took place at the annual biomedical research conference for minority students, also known as ABRCAMS. DERT members had a chance to engage with students from minority serving institutions about funding opportunities related to areas of environmental health sciences that are offered in programs at minority serving institutions. Recently, in April of 2022, a number of DERT staff participated in the Office of Science, Education, and Diversity hosted HBCU Connect Day. This was a virtual event to provide students and faculty from historically Black colleges and universities with an opportunity to connect with various NAEHS staff. And this was an opportunity for various members of DERT to engage with faculty, not only about various funding opportunities, but training opportunities as well. Future events will include a town hall with HBCUs and other MSIs who participated in the listening sessions, which I will talk more about in detail in the subsequent slides. And this is scheduled for August 11th. And we're very excited about our second Driven meeting in September. Next slide, please. So as a reminder, in July and August of 2021, the NAEHS invited faculty and administration from historically Black colleges and universities, as well as other minority serving institutions, including tribal colleges and Hispanic serving institutions, to participate in a total of 4 listening sessions to learn more about the barriers that researchers at these institutions have faced when applying to NAEHS for funding. The desired outcomes and planned outcome was to have an opportunity, first and foremost, to engage with faculty at MSIs through an active listening and learning process. And the hopes was that through this process, the information gleaned would inform NAEHS in devising responsive and concrete efforts to address identified challenges serving as barriers to those academic institutions with very diverse student populations and underrepresented groups in environmental health science research community, as well as the scientific workforce. If we think about the logistics, participants were invited to attend listening sessions with or without the presence of the NAEHS senior leadership across the Institute. This was intentional because we wanted to be considerate of the varying levels of comfort that some of the faculty members may have when discussing painful and sometimes complex issues in a very small and intimate setting with leaders of a funding agency present. Overall, across the 4 dates, we were really pleased to see that each session was well attended with diverse representation in terms of university type and region, as well as faculty member demographics. But I also wanted to take a minute to pause and to acknowledge the members of the working group, as you can see by the names listed at the bottom of the slide. This was indeed a cross-division effort that took a lot of time to plan and a lot of participation. And so that included efforts from Linda Bass, Sharon Beard, Takara Chamberlain, Heather Henry, Christy Pettibone, Laura Thomas, Leroy Worth, and Demir Wright. Next slide, please. So in the spirit of transparency and accountability, this slide is an overview of the proposed process and how NAEHS has and will utilize the information gathered from the listening sessions. So the work group reviewed notes from the listening sessions and identified key challenges and barriers. And let me be clear that there was no recording during this process. We wanted the participants to feel comfortable knowing that the only note takers that would be present were NAEHS staff and that this information would not be recorded for posterity. After the note-taking process, the work group took inventory of existing resources and created recommendations for strategies to address identified challenges. The work group then had opportunities to present these recommendations to our division leadership. And then following discussions and revisions, we then had an opportunity to have discussions with senior leaders across the Institute. Again, after having some discussion and having received a state of approvals, our acting division director, Dr. David Balshaw, shared a 10-page document with listening session participants that detailed the challenges identified during the sessions and the IC resources or the Institute resources and recommendations. The recommendations are now going to be briefly shared today with all of you during this council. But remember, the report back and detailed discussion of these findings and proposed actions will take place during an active discussion town hall during on August 11th with the listening session participants from these HBCUs and MSIs. Afterward, the hope is that we can share these themes and recommendations more broadly with our entire EHS community via our DEIA, Diversity, Equity, and Inclusion and Accessibility webpage. Next slide, please. So I will keep this summary brief, as it may be a tad premature given that we have not had an in-depth discussion with our listening session participants, but this again is scheduled to take place on August 11th. However, this is merely to provide a brief update on the very important ongoing process that we are having with our HBCUs and MSIs. Some key themes that emerged from the listening sessions included the need for technical assistance from NAEHS with regards to the funding process through additional understanding of grantsmanship. There was also a theme that arose around inequitable funding of MSIs compared to predominantly white institutions, or also known as PWIs. Inequitable support for research capacity and infrastructure to apply for NIH funding compared to PWIs also came up during discussions. And one specific example that arose was the differences in offices of sponsored services between MSIs and PWIs. Another theme that arose was the perceived bias against HBCUs in the review process, specifically around the scoring of the environment. Another theme that arose was limited opportunities for equitable partnerships with resource institutions when these partnerships happen between MSIs and predominantly white institutions. Next slide, please. And so while we recognize that many of the causes of the issues that were identified during the listening sessions are systemic in nature, and that these will take time to adequately address, the following recommendations may facilitate the process of authentic, inclusive, and difficult discussions that are necessary to move us toward a more diverse, equitable, and inclusive environmental health sciences community. And so as such, we make these recommendations knowing that this is going to lead to discussion and hopefully in the future, concrete action. So some of the recommendations that we included in the document were for NIEHS to provide and continue to provide opportunities for grant writing training and to continue to build awareness around training and funding opportunities through intentional communication efforts with HBCUs and MSIs. Additionally, to offer technical assistance in areas of grant writing, similar to the technical assistance program that exists that Pat was mentioning earlier, to offer assistance with grant writing, peer review, logic models and evaluation, translational research, and team science, which is being offered by Ms. Takara Chamberlain and Dr. Christy Pettibone. Another recommendation was to continue to support diversity-related funding and training opportunities through our diversity supplements, through diversity fellowships, and a list of other mechanisms that Dr. Maston will review in the following slides. Another recommendation was for NIEHS to consider ways to strengthen research capacity and infrastructure at MSIs through our sphere of influence, even though it may be through the facilitation of data sharing or through not facilitation of novel collaborations between historically funded and historically underfunded institutions. Maybe as an example, through the maintaining and enriching environmental epidemiology cohorts, or the U24 mechanism that was just, I guess, forward. Oh, I'm sorry, will be reviewed in June. Another recommendation was to create opportunities for engagement with NIEHS staff at workshops. For NIEHS staff to think about conferences like Abercrombie, CRAMS, and SACNAS and attending those workshops that support MSIs and HBCUs, and to continue to have other opportunities for engagement with NIEHS staff via email or other means of communication. And finally, to think about ways in which we can promote the Early Career Reviewer Program as a way to build capacity of researchers and staff at HBCUs and other MSIs, and being willing to adopt any new processes or training that the Nyc committee that Dr. Wojcik mentioned yesterday may recommend. And if these may include recommendations to improve the NIH peer review process, such as bias training for scientific review officers, review committee, and review panel chairpersons and reviewers. And so with that, Pat, I'll turn it back over to you. Thank you.
Okay, thank you, Melissa. That was terrific. This is maybe the second or third time I've heard either Melissa or Christy Pettibone present this, and it always just blows me away. It was a very creative and bold program to undertake. A lot of people were involved in it, and I'm just so glad to see it moving forward and coming to fruition. So as no, it's not going to let me go. Okay, so as Melissa mentioned, I'm going to give you a quick overview of some of the diversity-related funding opportunities here. I'm not going to go through every one. Some of these you're familiar with. We've talked about our diversity supplement program, which we have continued to grow in the last several years. Our minority candidate F31 fellowship program, and then we've recently joined in the Mosaic program, maximizing opportunities for scientific and academic independent careers. We have also signed on to the NIH-wide FIRST program, which is a faculty institution program where faculty are given extra money for being good mentors, as well as joining the NIH SURE program, support for research excellence. Other programs that we have been engaged in include the NARCH, or Native American Research Program, the epidemiology studies in Asian Americans and Native Hawaiians and Pacific Islanders program, as well as I think you'll hear about later, the Specialized Centers for Excellence in Environmental Health Disparities, along with the National Institute for Minority and National Institute for Minority Health and Health Disparities. So I'm going to change topics here very briefly and circle back to you with about climate change. This is just kind of to reiterate what Rick said yesterday. Even though we didn't get the $100 million we're expecting for this research program, we're still dedicated to doing research in this very important area. And so some of the things, and these again, just a reminder of what Rick said, we will be participating in the RFA for this new research coordinating center, as well as 2 RFAs related to SBIRs and STTRs related to climate change. And we're also going to be, and we have started looking at our investigative initiated applications, ones above our pay line, with an eye toward trying to invest in as many of these applications as we can. So with that, I'm going to stop, and I guess, John, if you want to quit sharing the slide, I will open it up to questions to council members, anyone else, and we will try to address any questions you have. Thank you. I'm not seeing any hands.
Give them a chance to warm up. You covered a lot of stuff.
I did. Again, I do want to thank the DEI working group that, again, self-assembled in DERT after the September council meeting. They've been done quite a yeoman's job. Okay, Phil, I see you've raised your hand.
Thank you. I was just first of all, I commend you for the efforts you're putting in here. It's clearly incredibly important. And I was looking at it in the context of broader NIH through the Unite initiative. And I can't help wondering, and I know from my own time at NIH, this was something I raised, but it's about evaluation. It's about the notion of, at the very beginning of, as you're gathering these data and preparing to make interventions, that as part of that whole process, there needs to be an evaluation mechanism put in place so you you can begin to see over time how successful these relative initiatives are, and you know, what's working and what's not working. And I'm looking at the Unite site, and I guess what I've heard so far, I didn't really see much of that. And I know, you know, the reason I find this a bit frustrating is because, you know, listening to, in the old days when I was there, Ecwtp talking about these things, you know, so much of it was evident 5 years ago. And it's just really how you decide what to action and then evaluate what you've actioned. And it's just that it's that evaluative process I'm asking about.
Yeah, I saw Trevor came off from the video, but I just want to mention you're absolutely right. And this is a kind of a tough needle to move, to looking at metrics such as successful underrepresented groups getting successful in getting NIH funding is a tough thing to move. We are looking at these metrics, and I'm hoping Christy is available. Maybe she can speak about this in a minute, but first let me turn it to Trevor.
Thanks, Pat. Phil, you're absolutely right. I will mention that you know, the Unite program is a year and about 3 months old, but we have actually have begun the formal process to do an evaluation, working through the KIPSI at NIH. So they are planning and organizing that right now, and so that is absolutely correct.
Yeah, I'm sorry, I meant Christy Drew. I may have said Petty, but I'm sorry, Christy Drew. Yeah, but I think it's also worth mentioning is the metrics for these kinds of things are difficult. Some things are simple, like the number of the percentage of applicants who are underrepresented to get funded. There's a very small number and has not moved much statistically over the years. So it's a very important thing you bring up there. So thanks. Marla.
Yes, thank you so much for such a wonderful presentation. And in fact, I have a question for Melissa, if that is okay. Melissa, I understand that you haven't discussed this with the participants of the listening sessions, but I was wondering if you can provide more details about their perceptions about the grant support and the grant administration apparatus of the university, and how NIEHS can help in transforming institutions and the structure of the institution to provide more support to our researchers.
Carla, for that question. Yes, so this is what we're hoping to get more into detail with our listening session participants on the 11th. But from what we heard during the 4 sessions, a lot of the concerns were just that, you know, it's sometimes hard for some of the MSIs to compete with some of the schools that they consider to be, you know, grant writing machines, because of the differences in the just the infrastructure in terms of having these offices of sponsored, you know, research programs, and even just being sometimes building awareness around changes in grant forms, or little issues that could be reasons why they're not getting funded compared to other programs. And their question to NIEHS is, what can you do? What is within the scope? There were questions around, you know, startup funding and things that make certain professors look more competitive. You know, that's probably not within our scope. And so I think these will be very interesting conversations on the 11th. And I think you touched on a good point, which is it'll be great for us to get a little bit more detail from them to hear what it is that they are looking for NIEHS to do, and keeping in mind that we have a certain mandate and what we can and what is outside of our scope as well.
Yeah, thanks, Melissa. That was a great question, Mara. That's a very important issue in this deal. Trevor?
Pat, yeah, thank you. I just wanted to mention to the council a reminder that on Friday, as part of the advisory council to the director of NIH, there's a general meeting that's open to the public. And on Friday morning at 10 and 11, there'll be 2 presentations, one describing work on a newly developing NIH DEIA strategic plan, and then a report also on Unite activities that will take place. And so perhaps maybe someone from the team can make those public Zoom links available to the council. Thank you.
Okay. Thanks, Trevor. And now Trevor Penny.
Sorry about that, too many Trevors. So I want to come back to Phil's point about outcome metrics. I think to have good outcome metrics, we need good baseline data, both for the intramural program and the extramural program. And I know this data exists, but I've not seen it all in one place. And it might be good to put together some kind of report. For the extramural program, I'm thinking that we must have really good data on many of the programs in terms of where we are currently in terms of underrepresented minorities. In the T32 program, the F31, the F32, the faculties that are represented in the P30 grants and so on. And I think if we don't have good baseline data, we can't see how well we're doing or what the nature of the problem really is. And I also would challenge NAEHS to look at their intramural program, to look at the level of diversity they currently have and actually identify any gaps and problems that they could actually tackle. You know, we're talking about spheres of influence here. And so, you know, the intramural program has spheres of influence that it could use to make things even better.
Yeah, thanks, Trevor. That's a great idea. I'm going to turn it over to the chair of our DEI working group. Karen, can you, I assume this is what you would like to respond to?
Yes, actually, yeah, good point, Trevor. Of course, that's what we have been working on, and Christy Drew has been really fantastic in providing us with that information. However, as Christy can tell you in much more detail, some of these numbers and some of these facts and figures are not quite so simple to define and to calculate and characterize. So while we do have that, we've been asking for that, and Christy's been giving us really an amazing, actually, Christy, the presentation that you gave us to our working group, I think would be amazing if you could do that for a big group like this at some point. I think that would really be informative and very helpful. She put together a great outline of all of the data that they have that they can give to us, because we need that as for the working group, of course, to develop sort of our strategic plan with our outcomes as well. So that is very important. But I think, and Christy, you may want to speak to this, but some of these numbers are not just quite as simple as it might seem to gather for a number of reasons, some of which it's, you know, due to protection and that kind of thing, for privacy measures, et cetera, and reporting issues. But it's clearly what we all need is data, and that's the only way we can evaluate anything, right? We're working on it. Christy's working on it.
Yeah, Christy, can you join in?
Sure. So going back to Phil's original question, I do want to just reassure the entire council, right? We are very much interested in evaluation. And Phil, it occurs to me that you're a fairly new member of council, and so you may not be aware that, so my branch, which is the program analysis branch, is entirely focused on evaluation of extramural grants at NIEHS. And so, you know, with Christy Pettibone being a part of this committee, we've definitely been thinking about, right, how do we envision not just the long-term outcomes, which are, you know, to really move the needle in terms of who's applying and getting grants, but how do we create some interim milestones that make sense? And Karen, thank you for setting me up perfectly, right? The data are really, really complex. And we took, after last council's conversation, we took all of the questions that the committee posed and kind of went through them for what do we have readily available? What can we answer? And that is what I presented, you know, to Karen and to the entire working group a couple of months ago now. And I think you know, I'm happy to bring that forward. However, the committee and council is interested in it. And I think the other important thing to harken back to Trevor Archer's comment, right, is that of course NIH as a whole in the Unite group is thinking about evaluation metrics, and so we're you know, definitely intending to coordinate and collaborate with those groups as well.
Thanks, Christy. Clearly a difficult challenge here. Do we have any other questions for council members or others about what we've talked about this morning? We're running a little bit ahead of schedule, but not too much. We can probably move on to our next agenda item. I'll alert John to get ready or Liam to get ready. So I want to thank everyone who provided input for my talk, and that was a lot of people from DERT. This was not a one-person operation, so thank you, and thank you all for listening. John, can you pull up Liam's presentation? The next thing we're going to be hearing about, which is kind of related to what we've been talking about, and I alluded to in my talk, is the Partners in Environmental Public Health program. This program has been around, as you'll hear from Liam, has been around for a long time, created probably before 2010, and with a lot of input at the time from council and other sources. It's probably a fairly unique program resource that we have for our grantees, and we're now looking at what to do with the program in the next 10 years. And so Liam's going to present an idea here. This is not a concept in the sense that we're asking for approval to spend grant money. This is an overarching kind of a umbrella program. We may come back with some concepts related to this, but for now, we just want to show this to you, get your feedback, and let you know where we are. So Liam, if you're available, I'm going to let you go.
Sounds great, Pat.
Thank you.
And I'm assuming you can see my slides.
Yes, sir.
All right, fantastic. So good morning and good afternoon, folks who are joining us today, council members, NIEHS staff, and colleagues joining on the video cast. It's a pleasure to be sitting here with you in this virtual forum again to talk about what Pat introduced as the Partnerships for Environmental Public Health, or PEPH. As you may recall, in February of 2020, a lifetime ago it seems, I stood in front of council and updated everyone on the progress that the Partnerships for Environmental Public Health had made since its inception in 2009, and how I would soon present an updated vision for the next 10 years. Well, it's been 2 years and the conversation is long overdue. So let's go ahead and jump in. For the next 20 minutes or so, I will cover the following outline. I'll talk about the background for new council members and to refresh others about what the Partnerships for Environmental Public Health is and what a couple of its major accomplishments have been. I'll then talk a little bit about the vision for the next 10 years, provide some detail on some proposed key elements, discuss the methodology for identifying and selecting the elements, and then outline some next steps for Partnerships for Environmental Public Health and close with a discussion with council members. So yesterday, Dr. Wojcik, and then this morning, Pat, both talked about how NIEHS has been supporting community engagement since the early 90s. Much of it began in the slide that you saw this morning in 1994, when Dr. Olden had listened to what community groups wanted and needed to address their environmental health concerns, many of which were environmental justice issues, reflected on the assets of the Institute, and encouraged the creation of novel programs. And as you saw on the slide that Pat showed today, many programs were established. I recently had the opportunity to look back at the programs and the language in those funding opportunity announcements. They were bold and innovative for the time. They helped to move the field. We established the Partnerships for Environmental Public Health in 2009 for several reasons, but primary among them was the recognition that many of these community engaged programs had become siloed. While each program shared common approaches, methods, research questions, populations, and tools, there was minimal interaction and little communication across the programs. Therefore, we envisioned the PEPH as a common space for grantees, community partners, and other groups, as well as DERT staff to come together out of their programmatic silos to share, learn, and build connections. Over the years, we've seen a maturation of this vision. So in fact, PEPH has really evolved into a community of practice for our grantees, partners, and NIEHS staff. It helps to integrate these ideas and practices, encourages learning from one another, and enables individuals to solve common problems. The examination and advancement of cross-cutting issues and topics has been the greatest benefit of the Partnerships for Environmental Public Health. Over the years, by nurturing a shared space, PEPH facilitated productive interactions, both virtual and face-to-face, among grantees and partners across the different programs and funding mechanisms. Through these collective efforts, PEPH helped to identify, shape, and advance new areas and opportunities in environmental public health, such as the report back of research results, which you heard about yesterday, as well as focus attention on issues and topics such as environmental health disparities and environmental justice that required continued attention. Often these interactions spark new directions. So how have we done it? We established the following 3 goals and a framework on this slide. As you can see, the goals are simple. Coordinate the programs with both grantees and program staff. Develop communication strategies to share environmental public health messages. Create and distribute materials to increase awareness about environmental health risks. And the framework helps us to think strategically where gaps and opportunities are in the context of environmental public health. I also want to emphasize that PEPH has always aligned closely with the NIEHS strategic plan, especially themes 2 and 3 about promoting translation, data to knowledge to action, focusing in on outreach, communication, engagement, prevention and intervention, environmental health disparities, environmental justice, and partnerships for action, as well as looking at building the next generation of researchers in this space of community engagement. And then thinking about scientific research and data infrastructure, as well as impact evaluation. So now, now I'd like to change and talk a little bit about what we've accomplished in the last 12 years. And there's been a lot, but I just want to focus in on 2 things. And in the document that's in the electronic council book, you can see some other additional accomplishments of the Partnerships for Environmental Public Health. But first, I'd like to highlight the Environmental Health Chat podcast series, which we established in 2013 as a way to provide listeners with the opportunity to hear about innovative research, learn about environmental exposures in health, and think about new and emerging areas of science and environmental public health. It has also been a strategy to amplify the accomplishments of our grantees and community partners. Each podcast has a page that talks a little bit about what the program is, what the focus of the lesson is, or the podcast. And then from that, it has additional resources to provide the listener with some new resources to learn more about the particular topic. These podcasts are getting picked up in different areas. For example, HRSA, state and local health departments, other e-newsletters have been picking up on these podcasts. And even recently, the European Public Health Association, June of 2020, recommended it as one of their top 5 public health podcasts. So it is getting quite a reach internationally as well as nationally. The other, and speaking of lists, I just want to quick touch on this. It was picked up as one of 45 awesome podcasts for public health students and professionals, coming in at number 3. We see that it hits the top 15 podcasts to listen to in 2020. It was number 10. One of the 30 best public health podcasts, it came in at 15. So I think that we're doing really nice. So if you haven't listened to a podcast yet, please check one out later today, share it with your family, friends, colleagues, and we're always looking for new topics. So if you've got an idea, send it to us. Finally, as you probably saw, we're getting on to a 10-year anniversary. So we'll begin planning something special to celebrate this milestone. The other big accomplishment really has been environmental health literacy. This topic has been a major contribution to environmental public health. My colleague Sima Finn, who's now retired, and I worked extensively together on environmental health literacy with the PEPH community, starting with a meeting in 2014. That led to commentary and environmental health perspectives, presentations at the American Public Health Association, co-editing a book with members of the PEPH network and community. And now we're starting to see environmental health literacy popping up in the peer-reviewed literature. Here are some publications from 2019. Now in 2022, we've got some additional publications popping up. So perhaps this would have all coalesced organically, but Partnerships for Environmental Public Health really served as that incubator for this concept that has now matured significantly. These are just a couple of examples, and I invite you to check out more of the examples in the document in your electronic council book. So now let's look to the future. Where are we going? I'd like to talk a little bit about the new PEPH vision, which builds upon the unifying environmental public health framework for the Division of Extramural Research and Training, as well as the Institute. PEPH affirms the division's ongoing commitment to community-engaged research and strong foundation to environmental public health, which we have defined as the science of conducting and translating research into action to address environmental exposures and health risks of concern to the public. Based on input from the extramural community, PEPH is going to add a new focus to its framework, action and sustainability. While the original framework highlighted the intersectionality of capacity building, research, and communication, this updated framework focuses on the process of community-engaged research from partnership building, capacity, to the implementation of public health actions and continued partnerships, the sustainability part. The extramural community emphasized the need to focus on these kinds of strategies to advance efforts in the area, ensuring infrastructure is in place at the end of 5-year awards, encouraging the sustainability plans, and designing projects programs for sustainability. But this is not just about NIEHS continued funding. We want to be thinking about it so that they're well positioned to leverage the successes of those projects to work with new partners and funders. So the 10-year vision, I've been asked, what's innovative about it? Well, I would say it's not so much about innovation, it's about impact. We want to build upon the success of what we've accomplished. The input received was positive about the overall vision of PEPH, and therefore these items align to the original 3 goals. We want to be an incubator for ideas. We want to amplify the key messages related to environmental public health. And we seek to continue to organize resources to have a place like our webpage shown here with valuable information for interested groups so that people don't have to hop from web page to web page. So but there is some novelty in the focus areas that I'll talk about. So Melissa teed this up pretty well as also in the notion of starting with a foundation of an anti-racist agenda. We've heard over the last 2 years the need to reflect, discuss, and act to address systems that have disenfranchised certain communities and populations. We want to make sure that the PEPH efforts are not contributing to those systems. Furthermore, we want to expand and strengthen our collaborative and facilitating role. We want to strengthen our efforts to promote action and sustainability of grant-funded projects. And finally, we want to advance our work in evaluation and measuring success of projects, programs, and even PEPH itself. So how did we select these 4 areas? So we did it through a variety of events. Initially, we were going to develop it solely based on feedback from the Partnerships for Environmental Public Health meeting in 2020. But then the pandemic and murder of George Floyd happened, and the conversations and priorities changed as they needed to. In the past 2 years, the vision has been informed by discussions that have taken place at these events shown here, the PEPH 2020 meeting, systemic racism discussions within the Environmental Health Sciences Core Centers, the NIEHS 5 Values conversations where Dr. Wojcik met with the community engagement course from our Environmental Health Sciences Core Centers program, from the HBCU and MSI listening sessions, which you just heard about. And then finally, the NIEHS Environmental Health Disparities, Environmental Justice faculty workshop on racism as a public health issue that Pat mentioned briefly. So recommendations and topics arose from those conversations, and we've tried to capture them and think about what that might look like in terms of aligning to the 6 elements of the Partnerships for Environmental Public Health. Now, this slide is just an example of how the recommendations were organized. We tried to also link them to the sources of the recommendations. And again, this is just a quick snippet, and in your electronic council book, you should be able to see the more detailed document. So let me jump into a little bit more detail. So in terms of the anti-racist agenda, we want the PEPH vision to be grounded in this. As part of the Core Center's anti-racism discussions, we've emphasized, and you've heard today, the importance about the spheres of influence. And so in this context, we want to make sure that PEPH efforts and activities are not contributing to the ongoing systems that have disenfranchised certain groups and communities. Also within the sphere of influence, PEPH, as this community of practice, could help to facilitate further discussions on power balance issues and community-university partnerships and strategies to address them. Some of these conversations are already taking place, as you heard, in other networks and groups, such as the NIH Unite program, and then the work that Melissa was just talking about. As such, there are new opportunities to collaborate with new groups, which brings me to the next focus area, PEPH's collaborative and facilitating role. So PEPH will continue to be this incubator for ideas. Its greatest value over the past 12 years has been to enable conversations across the different programs, as well as to highlight the accomplishments of our NIEHS funded projects within the PEPH network. It will continue to use this framework to utilize a variety of approaches and tools to bring people to the table on emerging and important topics to environmental public health, such as, but not limited to, the dialogue on innovation, best practices and community engaged research approaches, implementation science, or community engagement in precision environmental health. PEPH can expand to include the involvement of all NIEHS staff members. To date, it has been focused really on the efforts within the NIEHS Division of Extramural Research and Training. There are opportunities for PEPH to take on a more holistic structure to include the participation of members from other NIEHS divisions involved in environmental public health activities. Could dovetail nicely with the newly established EHG environmental justice faculty. PEPH will engage with other organizations that are part of the NIEHS Friends and Partners groups. This is a potential strategy too. While community partners from grant programs have attended grantee meetings or PEPH meetings, the Friends of NIEHS and Partners groups also have a similar role in terms of informing strategies and ideas that are coming in at a national and local level. It would be good to include them as part of the PEPH conversations. And then also we want to be thinking about working with and coordinating with other NIH institute centers and offices. COVID-19 has shown the value of community engaged research approaches. And so building and nurturing those relationships, which we do have with the National Institute of Minority Health and Health Disparities, but strengthening those in the context of environmental health, in environmental public health will be really good. And lastly, to coordinate even more so with the HHS offices and divisions, such as the newly established Office of Environmental Justice. We want PEPH to also advance its work in terms of being action-oriented and sustainable. Over the years, a vital message from conversations with grantees has been the need for time to build relationships and financial support to sustain them beyond grant funding. PEPH can help to identify those best approaches for doing this through strategic and focused discussions among work group members across the Institute. We can integrate recommendations as appropriate into ongoing programs and planned efforts at NIEHS as it relates to building the capacity of all partners to advance methods in sustaining relationships and encourage action-oriented project plans. So when I started the presentation today, I also noted that the foundation of PEPH is community engagement in the full spectrum of environmental health science research. In this context, PEPH will continue to advance and promote successful approaches in community engaged research. Two tenets of PEPH have been and continue to be its focus on and commitment to community engagement and translation of science, of research into public health action. So we've heard a little bit about measuring success, and this has been a chief accomplishment of PEPH in terms of helping our extramural communities think about evaluation metrics. And so we want to build on that, and we will continue to promote and use frameworks that are responsive to our community needs. At the PEPH 2020 meeting, participants emphasized the need to appreciate qualitative research approaches for evaluation, as well as to build community capacity and evaluation approaches. We want to examine the ways to provide technical assistance to community groups, academics, and other partners seeking to evaluate community engaged efforts, including the work related to environmental health, literacy, community agency, and action. So how are we going to do this? Want to think about four different strategies. I propose the 4 next steps for PEPH. Refreshing the PEPH working group, which is comprised of representatives from across the NAEHS, to be action-oriented and organized around teams focused on the 6 key elements of PEPH: coordination, capacity building, research, communication, action, sustainability, and evaluation. To meet with the PEPH with interested individuals, to be involved in the PEPH working group, to move that forward. Each of these teams would have co-leads, could have co-leads who possess the subject matter expertise and understanding of the field, with the goal of fostering even greater interactions across among NAEHS staff in these topical areas related to environmental public health. The intent is to leverage the collective knowledge and promote connections across programmatic areas. Of course, this is just one possibility. I'm also proposing to bring back council liaisons to enable consistent and sustainable information sharing on environmental public health issues from the PEPH to council members. I'd also like to start by convening a PEPH retreat for NAEHS staff and council members to develop a logic model and further flesh out the framework for action based on what we've heard over the last 2 years from the extramural community. Discussions could take into consideration ongoing and planned efforts to reduce duplication of efforts and leverage what is ongoing. And then finally, in the first quarter of 2023, I'd propose hosting a meeting to discuss the revised structure and aims based on the feedback over the years and from the PEPH working group retreat. The goal of the meeting would be to obtain additional feedback from the extramural community and set priorities and tangible next steps. So with that, I want to acknowledge the contributions from many folks, but also in closing to say that since 2009, PEPH has served as a community of practice for scientists, community members, educators, healthcare professionals, public health officials, as well as policymakers. It has become a well-recognized coordination and communication program for the NAEHS. And this new vision builds upon past successes and outlines focus areas that are responsive to key opportunities identified by our extramural community. Through continued support of PEPH and including broader participation of other NAEHS staff, this institute will further advance our leadership role in environmental public health. Establishing an action-oriented work group will reinvigorate the PEPH community of practice and provide sharper focus for opportunities that the Institute can use to leverage ongoing commitments. The structure is also well suited to help the Institute listen to topics and issues of concerns, reflect on the assets within the Institute, and respond in a cross-cutting manner, which includes communicating a coordinated message to all partners. I want to thank everyone from DERT, from the Office of Communication and Public Liaison, and the different contracting organizations that have helped ensure the success of PEPH to date. I also want to acknowledge the support of the extramural community in providing feedback over the last 2 years. The PEPH 2020 meeting was a resounding success in large part to the contributions of the extramural community. In particular, I want to recognize those who helped to organize and moderate sessions at that meeting: Beverly Watkins, Robin Fuchs-Young, Brenda Kester, Judith Zelikoff, Ben Richmond, Kathy Vandiver, Aubrey Thompson, Yosira Ornelas Van Horn, and Victoria Triana. So with that, I'm going to close out this presentation and open it up for council feedback and questions. And council discussants, just to kind of get it started, are Marla Perez Lugo and Jani Ingram. So with that, I will quit sharing. Thank you all for your time.
And thank you, Liam, for a great presentation. This is clear this program has really grown significantly over the years and is doing some very exciting things. So Marla, you want to lead us off?
Sure. It was such a good presentation, wonderful presentation, and such a successful initiative that there's little I can say without being repetitive. So I just wanted to call attention to 2 things. the new focus to a framework of action and sustainability. And that is important because most of the grant programs out there do not pay sufficient attention to the sustainability of the relationships. They are based on relationship building with community partners, but they don't provide the resources for those relationships to be incubated and to be sustained in between grants. So I wanted to call attention to that. And also the second point I wanted to call attention to is the focus on anti-racist agenda. So what it seems to me is that the initiative have been very responsive to council conversations and to, how things have been moving along in those terms in the United States in general. So the fact that they are adopting an anti-racist agenda on health disparities is very, very important. So I wanted Liam to go into more detail about this, because being just not racist doesn't mean to be anti-racist. So that involves action behind, and those actions can be perceived as political most of the time. So I wanted Liam to go into more detail about the anti-racist agenda.
Thanks, Marla. I appreciate the comment and the question. And yes, I recognize that it does require the action element to it. It has been something that we've been discussing within the Environmental Health Sciences Core Center's program extensively. So to what the action would look like, I think it would still require some further conversation, which we would like to make sure that we have the appropriate input, continued input from the extramural community and grantees. I think a lot of it comes down to the notions of examining various structures and how we might be able to enable the community university partnerships to be successful in applying for and achieving the goals to address environmental health disparities and environmental justice. I think Melissa's presentation touched upon some of the very similar kinds of issues. And so it would become considering that also in the context of, again, community university partnerships to address those local health issues.
Thank you so much. And, excellent initiative that deserve all of our support.
Thanks, Marla.
Thanks, Marla. Janie, did you want to join in?
Yeah, so the only thing, I really appreciated the presentation and really the presentation before as well, because I think the listening sessions and really trying to understand the issues. And I guess like Marla, I think the one area, the anti-racist agenda, and essentially just trying to make sure that, what is done, is going in a positive direction is going to be very tricky, because you can't please everyone. And so I know in some of the work that we do, you think you're doing the right thing, and maybe for many of the folks you are, but other people see it a little bit differently. So I think just moving forward with trying to get as many voices as possible, I think is really important. But I really am excited about the approaches that are in place and that are going forward. And so that was really the thing. Otherwise, I agree with Marla said. So great work, and I look forward to seeing how it progresses.
Thank you very much, Janie.
Yeah, I have to say, this on personal level, the webinars that the PEPH program produces are really revealing to me. You hear people talking about the research and really down at the ground level, not necessarily scientists, but the community as well. It gives you, at least to me, an insight and a peek into something you don't see by reading a journal or whatever. So I think those have been very powerful. So, all right.
Looks like
Trevor has a question. Yeah. Trevor Pinning?
Yeah, I'm just unmuting myself. Liam, this was amazing. I think the issue of sustainability is a really important one. And I think we really need to put more time and effort into this. You know, there's nothing more damaging for a community to actually do work with them and then walk away because the grant is run out. And, you know, that just creates ill feeling on everyone's side. And so we really need to think about that. Maybe there can be some kind of supplement program that's introduced for grants that fall between the crack so they can actually sustain those relationships so the communities don't feel that they've been left high and dry. The other comment I had for you was many other institutes are now emphasizing community engagement. The one that really comes to mind is the National Cancer Institute, of course, because historically those cancer centers have had population science programs, and now they're required to actually have community engagement as part of their cancer center structure. And I'm wondering if more can be learned by actually forming partnerships with some of these other institutes. And, you know, at the end of the day, as you know, we all gain by sharing knowledge. So I'm wondering if any effort's been put into that.
So Trevor, thanks a lot for that comment, both on sustainability as well as the other NIH institutes. And so with NCI, I've given a couple of presentations to their group in terms of what the Partnerships for Environmental Public Health is, but you're in the right space in terms of what I'm envisioning moving forward is that need for increased interactions in terms of not just with NCI and theirs, but we've seen it with NHLBI and NIMHD within the context of COVID-19 and the SEAL Alliance, the Community Engaged Alliance for COVID-19, which is really emphasized and accelerated a lot of the conversations on community engagement.
Great.
Yeah.
Can I add something to that? I think not only at the institute level, but at the actual investigators who are funded by these different groups. And I guess just one example is I'm involved in a pretty large NCI funded partnership between ourselves and the University of Arizona Cancer Center, but is to bring on folks like the environmental health researchers who get NIEHS money, but who are really good at community engagement onto your advisory committees and that kind of stuff. So you get you get sort of those expertise as well. And so sort of moving outside of, just cancer, but people who do things that will, as far as dissemination and all those things, it's really been helpful to not just say, well, we have to have cancer people in our advisory committees because we're a cancer funded program, is looking at expertise in these different areas, particularly with working with communities.
I forgot that's actually where we had first met, Janie, that big conference. That's right. Andre.
Liam, I enjoyed the presentation and I commend you wholeheartedly for all these efforts, which can obviously get quite overwhelming in the not only what needs to be done, but what the opportunities can be. And when you mentioned logic model, I think that would be a great place to move to kind of for the future. One of the things I guess that I keep thinking about all the time is how to influence the policymakers. And is there any information on any impacts that this activity has been able to make on Congress and getting them to appreciate, for lack of a better word, what needs to be done and to invest into this more? Or is that dreaming?
At the national level, I am not can't think of anything right now. I know that, as Pat pointed out, several members within the DERT Partnerships for Environmental Public Health Group are part of the HHS Interagency Work Group on Environmental Justice. I'm getting pinged by a colleague pointing out that through the Children's Environmental Health Centers, there have been, clearly through the communication streams there, helping to inform some of the discussions and raise awareness about children's environmental health. And, one of the things now that there's the new Children's Environmental Health Research Translation Centers to make sure that through PEPH, we're helping and dovetailing with the efforts that they have to communicate and disseminate environmental health findings from the children's, related to children's environmental health. So there are certainly opportunities there and examples by which we are making some advancements.
Thank you, Liam. That was a terrific presentation. And I just, I can't remember exactly when PEPH began. It seems to me it was probably in
2009.
2009. It seemed like it goes back even further because I feel like, I don't know, it feels like it's been around for a long time. And it just, the degree to which it has developed and matured is just so impressive that as programs go, some programs they seem like they have an arc, they're very effective, and then they kind of reach a plateau. And this one is really on an upward slope. And it's exciting that like those podcasts, which I actually didn't even know about, are getting cited in such high level circle, and broad circles. So yeah, I just want to really congratulate you, and just kind of a question in terms of this is a question that sort of comes up a little bit in our core center, which is when we're doing pilot projects. And we've made a big point of having community-driven pilot projects as really essential to our core center. But there's this question that a lot of my colleagues are asking, and you might be able to sort of help me with it, which is, well, this pilot is not going to lead to more, another grant. And I usually say, well, how about a research to action plan, action grant? But there is that push-pull between the research side and the community, making a difference in the communities. And, I've always argued, well, if this is leading to actual change, that's also good. Maybe another grant isn't the way forward for this particular community problem, but moving the dial on with some local or regional or even state kind of agency actions maybe is the point. So I just wondered your thoughts about that balance of the research and training mission of NAEHS, and how to balance that with sometimes needs that don't seem like they're as researchy as, I don't know. I think you know what I mean.
So I guess, and you're right, Irva, there is a range. There's a spectrum of community engagement, and each need is, each question has its own particular need. And so I think that it really comes down to the individual partnerships that get established. And when we're talking about community engagement and research, what is the specific need of the community, the questions that they have, and how can researchers help bring their expertise, knowledge, skills to address those particular questions. And the outcomes of that may be another grant, maybe it leads to additional NIH funding, maybe it's state funding, maybe it's foundation funding. But I think at the end of the day, it's about making sure that it's being responsive and that there is some type of an action that helps to reduce, mitigate, or help address, or even going to Andre's question, informing some type of a public health policy that will reduce those continued exposures.
Yeah, yeah. I just have a quick follow-up, which is you mentioned that there's a pause right now on the research to action initiatives grant mechanism. And I'm just wondering where that's going. Like, is that going to be coming back in another form or?
Well, I guess I would look to others, but we've been working on that internally, and I would just say, just kind of keep your eyes open as things, progress. But yeah, we're having those conversations.
Thank you very much.
You're very welcome.
And I would add, yes, William said, keep your eyes open. I also add, this is an area that we're still very much devoted to. So it's a high priority area for us. Any other questions for Liam or for the others at DRT who've been involved in this process? Karen.
Yeah, I have a question for Liam. First of all, wow, we're really impressive. And I know you already have so much under your umbrella, but I wonder, so we talk a lot about community engagement and then community-based research, but I think everything that NAEHS does, from basic mechanistic science on up through direct community research and engagement, is impacting the community. So I work on genetic instability. Well, that could affect, that does affect all of us, right? So that, I wonder if, not to add more to your workload, but would there be a way to sort of engage the community in all of sort of the research that NIEHS does, from very basic mechanistic that, we certainly give a lot of talks to lay audiences in that regard, and they really appreciate it, all the way through actually interacting with them, and they could see the entire spectrum. And maybe you do this already, I'm just very naive to it. That's another thing, is there a way, a better way, an easier way, I guess, to involve more people, scientists and non-scientists, in what you're doing? Because I think many people would not even be aware. And I know you have the podcasts, and we have the listening sessions, but those even, I mean, as valuable as those are, I think they're not reaching as many people as we would like. And including every bit of what NIH does under its entire portfolio, I think it relates directly to community. Just some thought. I don't think you could, I mean, that's a lot to ask. I just wanted to put it out there.
Well, and I think that's the value, the reason that we wanted to have this conversation at this point in time, as we're thinking about sort of the next 10 years, what are some of those opportunities? What are the ideas that we might want to be thinking about in terms of opportunities? And you've raised some really good ones. And I know that the conversations around precision environmental health come into play. What is the role of community engagement, the exposome, in terms of community engagement? So there are different nuances and different opportunities for that. And like you said, yes, there are only 24 hours in a day. And so it will come down to prioritization of what those key issues are and how we might be able to leverage what we have ongoing within our current portfolios to make sure that we get at some of those. So I think those are the types of brainstorming issues that are very important. So thanks for bringing it up too.
Yeah, I just wonder if, when you have your forum and you have your groups there and you're actually interacting with them, if maybe there would just be like adding on to those events or those workshops where you show sort of the entire, one example of each type of, sort of, I don't know, not funding mechanism really, but sort of research in the overall portfolio of NIEHS, I think would be really impressive.
Okay.
I mean, just as an add-on, right? So you wouldn't have to start something brand new. I get it. No, very impressive. Thank you for everything that you're doing. Yeah.
Thank you, Karen. Terry, I see your hand up.
Yes, thanks, Liam, for a great presentation and a wonderful program. I'm highly supportive of it. I'm wondering, as we look forward to the next 10 years, as you consider what kinds of things that might be done, to put some of the emphasis into the notion of hypothesis testing, if you will, and interventions, and which interventions work and which ones don't. In other words, as part of the evaluation process and assessments of the program's success, I think it might be interesting to think in terms of, as we do in public health, where we like to say, you know, associations are one thing, but interventions that prove the point are often more compelling evidence. So I'm just wondering if this might be raised as a thing, not only for grantees, but also for the PEPH program itself.
Okay. So no, I think that, you know, as we think about sort of the, you know, the action areas for, you know, in terms of hypothesis testing interventions, that would certainly be, I think, something to consider within that particular area of the framework. But, you know, again, that's something, you know, again, PEPH, and I want to come back to something that Pat said, you know, we're about facilitating and enabling those conversations, and then, you know, to be thinking about those gaps and the opportunities, and any sort of funding opportunities that would come out would have to be developed separately and be brought back to council. But, you know, and interventions can be quite costly type of thing. So we have to be thinking about budgets too.
And it's a great point, Terry. And I'll remind you that I mentioned briefly in my talk about the intervention research symposium that Lindsay Martin put on earlier. This is an area I think we'll be moving toward, and how that interdigitates with the, I think it's a natural interdigitation with the PEPH program. So it's great. It's a great point.
Yep.
Any other questions? Thank you for your interest, and Liam, thank you for a great presentation. We're running
Thanks,
a little
everybody.
bit.
Bye, everyone. Great presentation, by the way, Liam.